Technique. Wait for the client's head and neck to relax. As relaxation occurs, the head will feel heavier in your hands. As you perform this hold, quiet yourself and see what you experience in the moment. It is very likely that you will feel the occiput flatten into the thenar portion of your hand as the cranial rhythm moves into flexion. You may also experience a feeling of random movement. This may be the occiput unwinding from a compression or restriction. This movement will slow and then stop as the occiput self-corrects into a healthier position. In addition, you may also sense the cessation or stopping of all movement. This is referred to as a still point. A still point means that the body is experiencing a deep state of healing. Maintain this hold for no longer than 5 minutes. Chapter 2. The Reciprocal Tension Membrane System and Fascia. Membrane System of the Skull. The meninges of the brain and spinal cord provide protection, stability, and house the shock-absorbing cerebral spinal fluid. The layers of the meninges covering the brain and spinal cord are pia mater. Between the pia mater and the arachnoid lies a space called the subarachnoid space. This is where the cerebral spinal fluid circulates. Arachnoid mater. Dura mater. Located inside the skull is a meningeal structure. Sutherland referred to this as a reciprocal tension membrane system because the meningeal sheaths stretch from the anterior to the posterior aspects of the skull, as well as from side to side. This system is comprised of the same meninges as those covering the outside of the spinal cord and brain. These meninges, however, support and divide the hemisphere of the brain. The three membranes appear as sheets and are as follows. Falx cerebri. This sheet of tissue is shaped like a crescent moon. The front part attaches to the ethmoid and the frontal bones. The falx cerebri runs posteriorly along the sagittal border of the skull and then drops inferiorly as it attaches to the occiput. The falx cerebri separates the right and left hemispheres of the brain. Tentorium cerebelli. This sheet bifurcates or separates at the point at which the falx cerebelli merges with the outer meninges of the occiput. When it separates, it extends laterally along the temporal and parietal bones and moves anteriorly, attaching to the sphenoid. The tentorium cerebelli supports the weight of the brain and suspends it above the brain stem. Falx cerebelli. This sheet is a small extension of the falx cerebri, which extends below the tentorium cerebelli. The falx cerebelli attaches to the foramen magnum and then blends into the meninges of the dural tube. Dural tube. The spinal dura attaches at the foramen magna, C2, C3, and the second sacral segment. The dural tube creates a physical and energetic relationship between the occiput and the sacrum. Spinal nerves also exit through the dura as they extend distally in the body. Cross-section of the membrane system. As the bones of the skull are decompressed in a cranial-sacral session, the membrane system is also affected. The membranes or sheets undergo the same traction because they are attached to the bones of the skull. This traction encourages any restrictions in the tissues to release. Restrictions in the membrane system are called membranous restrictions. These restrictions have an elastic quality. Restrictions create a feeling of the bone moving into the direction of traction, but the bone will appear to snap back down if the therapist were to release the hold. Restrictions may also exist within the sutures of the bones. These restrictions are called osseous restrictions. Osseous restrictions feel firm and immovable as if the bone were stuck. This diagram illustrates an anterior view of the skull. The falx cerebri runs from the sagittal border inferior, where it merges with the tentorium. The tentorium attaches at the occiput, moves anteriorly along the lateral sides of the cranium to attach at the sphenoid. The duratube begins at the occiput and extends to the sacrum. Releasing fascial restrictions in the body. Fascia is a tough connective tissue which covers everything in the body, including bones, nerves, and organs. It is often described as a stocking because it is one continuous sheet connecting everything in the body. Its purpose is to support, compartmentalize, and lubricate different elements within the body. Fascia allows the body to interact holistically, even though the body is a summation of different parts. This also allows each system to maintain its own integrity and function. There are 4 concepts to remember when working with fascia. 1. The fascia system is a single system. You can follow the length of the body uninterrupted just by following the fascia. 2. Majority of fascia fibers in the body run vertically. 3. Some locations in the body have a dense collection of horizontal fibers. These add support to these otherwise weak areas. 4. Fascia, under ideal circumstances, is very mobile. Diaphragm areas. In craniosacral therapy, the areas of dense transverse or horizontal fibers are called diaphragm areas. These diaphragm areas are in the trunk of the body and may be subject to forming restrictions. This susceptibility exists because these areas hold many internal structures, like organs. When restrictions or scar tissue occur in these areas, the fascia becomes shortened and dense. As a result, the area loses mobility and energies circumvent the dysfunctional area. Fascia unwinding is applied to release these diaphragm areas. Demonstration. Diaphragm release. Hand positions. Pelvic diaphragm. Place the one hand underneath the sacrum, perpendicular across. Place the opposite hand on the lower abdomen, in between the ASIS, with the little finger resting superior to the pubic bone. Both thumbs should be pointing towards the client's head. Respiratory diaphragm. Place the bottom hand underneath the client's back at T12. Place the other hand over the anatomical diaphragm. Thoracic diaphragm. Position the bottom hand beneath T1 through T3. Use the opposite hand with the thumb and fingers forming a V to contact the tissue immediately inferior to the clavicles. When working on female clients, it may be necessary to use only the fingers and work one side at a time. 1. Begin each release by lightly placing your hand on the diaphragm area. This technique needs only 5 grams of pressure, but more may be used. 2. If you need to use more than 5 grams, increase your pressure slowly. 3. As the tissue responds, it will feel as if it is twisting or sliding in one direction. Follow this movement until you get a sense of where it does not want to go. 4. Gently glide the tissue in the direction of non-movement. The tissue will resist as you take it where it does not want to move. Meet this resistance by holding the tissue in this position, or gently encourage it to move further into the restricted area. The tissue will gradually move into the area.